Hello, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you a special Friday edition of our COVID-19 community briefings. By now, you understand that we are into basically a weekly kind of briefing, and that I had promised to do more briefings if something came up. Something came up, and so here we are, and I'll get into that in just a minute. Before I do, I wanted to give you a quick update on our status in Sioux County and in Iowa. Both of those categories, Iowa and Sioux County, continue to improve. Iowa's 7-day average is 8.3%. Sioux County's 7-day average is 8.1%. So that both of those are down from Monday, and are decent, that they're staying in the single digits. The 14-day average in Iowa is 11.1%, again down from Monday, and Sioux County is 11.3%, again down from Monday. Sioux County's population positivity per 100,000 population is 128.9. Again, a pretty significant drop from Monday. The state average is 215.3 per 100,000. And so Sioux County in that is showing very well, about half of what the state infectious rate is. And so both of those comparisons there are good. The county continues to move in the right direction. It's not over yet, and we'll continue to say that, but we're certainly on the right path. Now, for the reason for the briefing today, I continue to mention that the situation is very fluid relative to our ability to both receive and administer vaccine. Yesterday, Thursday, January 21, the governor rescinded the order for giving vaccinations that was issued on January 15. And this is primarily directed to the 1B eligibility group that is expected and will be happening on February 1. The primary change in this rescinded order was moving from 75 plus, people aged 75 and older, to people aged 65 and older. So you say, well, that's 10 years, it's not a big deal. We were really gearing things up here for 75 plus, and yesterday we were informed that it needs to be 65 plus. Well, why is that a big deal? First of all, we're very pleased with this. It's a good thing. But when we just look at our patient base alone, just to give you an idea, the 75 and older group is north of 1,000 people. When you go to the 65 group, we are nearly at 3,000. So that has really caused us to take a hard look at how are we going to do this, and I'm here today to explain to you how we are going to do this. I do want to show a graphic, and I'm going to try to share screen here a little bit that will show you exactly what we're talking about and how we are going to be administering the vaccine. Again, this is from the Iowa Department of Public Health, and it's phase 1B in order of priority. And it does say persons aged 65 and older are eligible for the vaccine during any one of the following 5 tiers. And I can tell you right now that the 65 and older group is going to be a priority of Orange City Area Health System. And I believe that, and I'm not speaking for the other health systems in Sioux County, but I believe that they are employing a similar priority. Because again, clearly, the mortality tables, the demographic information on the desk would clearly support that this age group is the most vulnerable. But in addition to that, and as available, tier 1 folks are next in line, and that includes first responders and PK through 12 school staff. You can see on that graphic. Also, then tier 2 deals with agricultural workers, manufacturing workers who work or live in congregate settings that do not allow for social distancing, individuals with disabilities, and then you move into tier 3, tier 4, and tier 5. Again, keeping in perspective what this means for Orange City Area Health System as an example, the phase 1B age 65 and older are about 3,000 people potential for almost that many. And so volume in terms of how much vaccine we're going to get. All right, so I'm going to stop. And if you want, you can go on the Iowa Department of Public Health. I would imagine it's on the Community Health Partners, and you can take a look at this a little bit closer if you'd like. Okay, so with that said, and with that priority emphasized, beginning Wednesday, next Wednesday, January 27, Orange City Medical Clinic, and it will be only our Orange City Clinic, 737-2000, will be accepting calls and scheduling vaccinations beginning the week of February 1st. The eligibility for that vaccine is you must be 65 or older. Appointments within that age category will be made on a first come, first served basis, but again, only in that age category at this time. As I mentioned numerous times in these briefings, all of this is dependent on our ability to get the vaccine. If the supply holds up, we can honor the appointment and everybody's happy. If the supplies don't hold up, we will need to reschedule, and we will take responsibility for getting a hold of you and informing you of that, so that you don't come in and then say, oh, sorry, we don't have the vaccine. In setting up the appointments that we have, we're trying to do our best to estimate the volume of vaccine that we will be receiving. We have some pretty good ideas. If we receive more than the appointments that we've set up, we will schedule more appointments. If we receive less, we'll have to reschedule those appointments. But nonetheless, we're trying our best to be as efficient as we can, and we're going to go ahead and schedule that based on the faith that our estimation is accurate. So that's where we are with that. Another thing, and most of you know by now, these are the Moderna vaccines, and as such, require a booster dose, and that booster dose is 28 days post primary dose. When you come in for your primary vaccination, you will be given a booster dose appointment as well, and that'll be 28 days from your primary dose. So that will be scheduled, and we will make sure that we have adequate supply for that booster dose. So get your primary dose scheduled, come in, you'll get your booster dose scheduled, and hopefully in about 6 weeks you'll be with full efficacy of the benefit of that second dose. As we've tried to do and communicate throughout this process, equity is something at the forefront of all of our thought. We want to be as fair as we possibly can. We want to follow the rules and the guidelines as best we can, and we believe so far we are doing that. At the same time, we want to be as efficient as we can, not to waste a single dose, to get the vaccine that we have in the arms of someone as soon as we can, and we want to make sure that we do that in as equitable and as fair a way as we possibly can. We may not always be able to succeed in that to everybody's judgment. And so as we go through this process, again, with each other and with us, we ask for grace during this period of time. We ask for your understanding and to trust in us that we are going to get you that vaccination absolutely as soon as we can. We've talked in our sessions here, our management groups here. We do not want a single dose of vaccine on the shelf if we can possibly avoid it. And so we will be scheduling these appointments beginning next week, Wednesday, 737-2000. We're going to have extra staff available to take your call. It's going to be busy. And again, within the volumes that we discussed, that's our priority and that's our focus. And again, it's going to be supply dependent. Thank you for listening today. I will be back on Monday with likely another change. But again, things change very quickly. We have a good idea on the vaccine and what's coming, but things change. And so we'll look forward to a briefing on Monday. I'll give you a little bit more statistical information and maybe a little further direction as to scheduling an appointment as well. Have a great weekend. Stay vigilant, stay strong, and stay healthy. Thank you.